Hi, it's me again, Jareen Bautista, and I am back. If we recall from our previous episode, I had a baby Botox and a baby laser. And as you can see, I have better looking baby skin. For this episode, my concern is my sunken eye, and I think we're going to be treating it with an eye filler and a bit of Ulthera. Don't forget to subscribe and click the notification bell.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a 2-week follow-up of Jareen Bautista. Welcome back.
Hi everyone.
Yay. So 2 weeks ago, we did these injections of microtoxin or the microzeomin intradermal injection, and also we did some baby skin laser. Now, let's ask Jareen. How was it? How many days was the redness, and what did you notice after that?
Honestly, it was only red right after the procedure. That same night, it was slowly fading, and then the next day, halos wala nang redness. I didn't even notice it. So that's how I didn't even make an impact. Na the next day, I was worried about how red it was. It wasn't anything like that. I think you only see a bit of marks, which fade away eventually. Also.
The next day?
The next day or like couple of hours after.
Oh yeah, so it was just like an immediate fading away of those. Yeah. Like for example, the laser that we did, there was redness, and then also the injections, there were redness, and also the tiny bumps.
Yes. So the bumps went away, I think the next day. The redness went away that same night.
So there you go. It was just a transient like erythema, and as well as those transient bumps on the skin. And then how was the effect on the skin pores?
I did not see the difference of the pores, mainly because before I would notice the pores being there, and now I don't really see any pores. I don't really notice them anymore.
Right now, because I was looking at Jareen's skin right now, specifically the anterior cheek where we did injections. I'm looking at the pores were minimized. That's the term there, or it was reduced. Of course, we still have those skin pores, but you just tightly reduce the size of the pores. Okay. Now, what about the forehead? The forehead, we did some injections also, right?
Yeah.
The one that I was correcting before was the beginning line on the center of the glabella, or the so-called beginning frown line. Okay, how was it?
I don't look angry anymore.
That was the concern. This one here. So, see, so after 2 weeks, see, I don't see it anymore. I used to see it, but now, wow. And it's like the result is natural. So we can still see movements of the brow, okay? The shape of the eyebrow is still good. And we did some tiny injections also on the forehead, and I was concerned before with the beginning lines on the forehead. Okay, so there's a significant improvement from the treatment we did last time.
Yes.
Yay! Okay, so in today's episode, we've mentioned during that procedure that we will also be treating the so-called midcheek groove and also the under eye region. So, kasi Jareen, she's studying ComTech. So, always puyat.
Yeah.
Okay, so we wanted to also correct the under eye region. And I wanted to also improve the mid-cheek area, I wanted to restore that OG curve because I'm noticing already a beginning sagginess here and a noticeable mid-cheek groove and also a deepening of this nasolabial fold. So what kind of procedure are we doing for Joreen? Let's watch for it when CSI Medical Aesthetics return. Back mga ka-CSA. So we are doing a procedure for Joreen whereby we wanted to correct this mid-cheek region here. Okay, so we wanted to improve this part to prevent the further sagginess or the descent of the tissues here. So we want this to be lifted like that. And of course, we wanted to restore the so-called natural OG curve, whereby there's this like convexity on the cheek region. Actually, she still has that convexity. It's just that the position is somehow lower, so we wanted to restore it upward like that. So ideally, for the cheek region, for women especially, we wanted to achieve that high cheekbone here, particularly the zygomatic prominence. We want it higher like that. So we will also prevent the descent of the tissues here, particularly the nasolabial fat pad. We want to address this so we prevent the worsening of the so-called nasolabial fold. Okay, Joreen? So the kind of procedure that we will use for Joreen right now will be the so-called Ultherapy. So we can target the mid-cheek region, make use of this device to reach the fat pads there, the subcutaneous fat layer, and also a portion of this mass layer, the superficial musculoaponeurotic layer, for it to contract from within and cause a tightening and lifting effect. So this is a device that's very safe and very effective. Okay, we actually had presented this to you already in the past, and immediately after, actually some of my patients, when we do it, they already appreciate a result after, and they feel this tightening from within already. So I have this 3.0 millimeter transducer here. So I'll be working particularly on the mid-face region here. So this part here will be lifting that. Okay. So for Joreen, she will be just relaxed. Okay. And the device has this. Okay, we'll be using 0.35 energy. Okay. So targeting this, okay, ideally you make a land markings, okay, but in my practice, I just target the anatomical area which I needed to work on. So I'll just pinch this part here and place my transducer like that, and then press on the switch on button, and then first shot. You felt some pricks?
Yeah.
Yeah, actually this doesn't have any needle. Okay, but it has this like energy beam.
Very cool.
Exactly, that can really penetrate into the inner layer. Exciting, right? See, it's your first time.
Yeah.
It's Joreen's first time. Okay, at first she's anxious about it, but you know, there's no needle.
Yeah.
It's just like an energy pulse entering within. Okay, so actually I'll be doing like few shots only here. We'll be giving her like 20 shots here and 20 shots there. Okay, we can make it 0.3. So my goal is to, yes, 0.3. My goal is to lift this part here. So I'll be continuing with the treatment. I just kind of tested. Okay, I just did the testing, initial testing on that one. So we'll be doing 20 shots here. Okay. How's that? Okay, right? So actually, before we do this procedure, you do your cleansing, apply your topical numbing cream. So a while ago, lidocaine cream was applied, right, Joreen? Then you leave it for like 45 minutes, even to up an hour or more. Like when I do my topical numbing cream, I wanted it to stay on my skin longer. So it's gonna be really numb. How was it?
It's okay.
Okay lang, right? Yeah. Then for some of my patients who are like anxious of the Ultherapy, because others are saying masakit daw or it's painful. Okay, what we do for them, okay, aside from the topical numbing cream, Some will use some squeeze balls there. The others will have some cold substance on the other side, just to, you know, divert your attention on the procedure. So like for example, if you have like a cold, like an ice roller there on one side, you can use that, so it's relieving the sensation of discomfort. So far okay, right?
Yeah.
So,
but it's okay.
Yeah. So I need 2 more. And then last one. Okay. So that's for the right side. Then let's proceed with the left. Okay. So same number of shots, but actually later on I'll add more on this side because I noticed this one is saggier than the other. Okay. So you also have to check on the so-called face symmetry. So there are cases whereby one side can be lower than the other side, or one side can be bigger or more prominent than the other side. So you can also do a balancing procedure just to improve the face symmetry. Okay, so this side here. So for those performing Ulcera, they know that the land markings, they follow certain regions. Okay, although this kind of procedure, actually, if you want to just target certain anatomical part, you can just directly do a procedure on that part, not necessarily doing the entire face. So you can just correct one anatomical region in one treatment. Okay, so far so good. Actually, the numbing cream will still help in the, you know, addressing that pain or discomfort while doing the procedure. Because you really feel some tiny pricks there, or there's a temperature also because we wanted to reach the fatty section. We wanted to induce a so-called somehow, for some cases we do fat reduction using this. So depending on the kind of transducer that you will be using. So this is a 3.0 millimeter transducer. So basically the 3 millimeter reaching the dermis and the subcutaneous layer. Okay. There are cases that I use a 4.5 millimeter, so that transducer will also reach the so-called mass layer. So I've done 20 shots, 20 shots. Actually, I need to add a little bit more here. As I've mentioned, I can add 10 more shots. Okay, so that's using the 3.0. And I still have a 1.5. We'll add here so you can lift it further. So the first shot, Joreen felt it. It's kind of like made her surprised, or at first like because you didn't know yet how you will feel. Usually for the first time, patients that I do this, because at first they're so anxious. So right now Joreen knows. And I need 2 more shots. And the last one. Okay. There you go. So later on, I'll be doing also the 1.5 millimeter transducer to address the nasolabial fold. And before that, let's talk about the under eye region. So the infraorbital part of our face, okay, there are cases whereby they have concerns on the lack of volume, or the others have the hollow under eye or sunken under eye, or the others are concerned about the dark circles, or the others are concerned about lines under the eye or sagginess under the eye. But for Joreen, our concern is that there's also the so-called lack of volume. Okay, it's sunken, hollow, and causing that pigmentation. Okay, so we want to, as early as now, we can correct that. Okay, so what kind of procedure am I gonna do? What do you think?
Eye filler. Eye filler.
Yes.
Under eye filler.
Correct. Okay. Because actually, we also prescribe some topical creams for the under eye. But you know, even if you apply those creams for a long period of time, still, you have the problem. Okay. Because I remember when I was a med student, I have this raccoon eye. Yeah, really dark. Because during medical school years, we really don't sleep to study. And then you have this dark circle. It was my problem for a long period of time. and you've been buying expensive under eye creams, eye serums, but still you have the problem, okay? And the good thing right now, we were able to have these treatments under the eye, making use of hyaluronic dermal filler to address that concern. So good thing for Joreen, we can already do a dermal filler. Okay, she's 21. It's okay. Because when I look at you, it's like you're still a high school student.
Really?
Yeah,
Even
you
if
look so young. Yeah, but even though, well, there are cases already, even in those pre-teen years, they already have sunken eye or dark circles. Like my 9-year-old son, I have a photo of him. He has this dark circle already, but he has a history of allergies. For those people with allergic rhinitis or any history of allergies, they tend to have this under eye problem. It's either hollow or sunken, or there's pigmentation there. Especially those with allergies around the eye area, they tend to have this pigmentation. So for my child, he's only 9-year-old, pero he has that already. Or we call it also sometimes tear trough deformity. Okay? So let's prepare. So of course, before any injections, we have to clean the area, disinfect, sterilize with our cleansing solutions. Okay? So whenever we use needles, we really have to keep the skin clean, sanitize, to, that's the one thing we also have to prevent. We prevent infection also. Okay? So just disinfect the region. And then the dermal filler that I will be using for Joreen, it has to be a light dermal filler. It has to be a filler that will blend well under the eye, integrate very well in the tissues under the eye, okay? So for her case, I'll be using a low molecular weight type of dermal filler, something that is not so viscous, not too much in viscosity, or it's a low G prime type of a filler. Something that has this very good flexibility, something that's also soft, something that's gonna also blend well and become homogeneous and not give you that lumpy effect under the eye. Especially this part, we have a very thin skin. So we have to use a filler that's also thin, okay? A thin filler for a thin skin. Because the under eye region actually in our face, this is the part that has the thinnest skin layer. Because when you palpate it, it's already, you feel the orbit, the bony orbit, the infraorbital rim or lower orbital rim. Okay, for my under eye filler injection, I make a landmarking, a vertical line from the lateral canthus and then a horizontal line to your alar groove here. So this will be my entry point. So cotton with alcohol. For the beginners, those who are novice in dermal filler injections, you really have to make that marking, okay? So in my case, I already have this point here, my entry point. So Joreen, I'm just gonna make a tiny prick there. Okay. I'm using a gauge 23 introducer needle. Okay, so we can switch off the Ulthera. And I have with me a filler that's that we call beta light filler, okay, low molecular weight. And I'll be using cannula, gauge 27. So it's just an introduction of this soft cannula here. So soft cannula, and then we'll just glide. We'll just glide it here. Okay, I'll be gentle. So you feel like there's something going in. Yeah, there's a pressure. So I'm already in this part here. Actually, the medial soup region. I'm not in the tear trough region yet. Okay. So I want to start in the medial soup. I want to correct it so that we prevent the sogginess in this part here. So just a little bit push there, small amount only. So when I do my filler under the eye, I give less amount. Then I also want to correct the so-called tear trough. So we call that tear trough. So I want to glide my dermal filler with the cannula towards that medial canthus. So there, I'm already in the medial canthus inferior border. Okay, I'll inject small dose only or small amount only. There you go. The goal is to give that even surface, smooth surface, and to improve the skin texture as well. Actually, hyaluronic, it's hydrophilic. It attracts water 10,000 times. So it's gonna hydrate Jorin's skin also, specifically in the under eye region. And I wanted to correct the mid-cheek groove, so in a linear retrograde technique, I can push a little bit of my filler again towards this mid-cheek groove here, or a part of our nasojugal line. Okay, so I'm done on the right. I used 0.5 cc of our dermal filler. So let's move to the left side. We're proceeding to the left side. Okay, so again, disinfect the area, and I already know my anatomical landmark. So I make a tiny puncture again using my gauge 23 introducer needle. Okay, inhale, exhale, just a prick there. And again, I have my light dermal hyaluronic filler here. And then I'll just insert the cannula and then glide it towards the tear trough. I'm gonna be starting already here in the tear trough region. Actually, I noticed the right side is more severe than the left, so this side here I'll be using less of our dermal filler. So it's really expected to have this so-called face asymmetry. It's like the left and the right, they're not really equal, so one could have a lesser degree of problem. Okay, so I'm gonna glide back again just to fill in that hollowness there, that sunken part there. Okay, there you go, just tiny aliquot, an aliquot of my filler again. Okay, so we've done Ulthera as well as dermal filler for the under eye and the mid-cheek groove. We'll show the result to Jorin when CSA Medical Aesthetics returns. And we're back, mga ka-CSA. So we'll now show the result to Jorin. So Jorin, here's the mirror and you can see what happened.
Wow!
Yeah. So the under eye.
This one, it's just
temporary.
Wala na yung
Exactly, the groove.
gone.
Yeah, that line.
Yeah, it's gone.
From the medial canthus area going to the lateral aspect of the cheek. We call that the Indian line or mid-cheek groove, mid-cheek line, or nasojugal line. So that was the one I was targeting with our dermal filler. And also with our Ulthera, whereby with Ulthera, have you felt anything after the Ulthera? Do you feel some sensation of tightening already? Something
After
like that?
Ulthera, yes.
Yes.
I definitely felt like my skin was
Yes,
tighter.
yes. Like even when I do my Ulthera on my face, somehow you feel inside there was something like that had this contraction from within already.
Yeah.
Yeah, and I can really appreciate right now the reduction in the nasolabial fold. And with the Ulthera, you will still see results like up to 12 weeks because this one stimulates collagen formation. So since our guest is still young, very young, Jorin is still young, so the formation of collagen are still very active. That's why among young ones, it's really very effective, and they can easily see results because they still have these active cells that will synthesize or produce your collagen, elastin, and other extracellular tissue matrix. Anyway, you're so scientific already, right? So the under eye region, we filled in with our light or low molecular weight dermal filler, hyaluronic filler. You just have to drink a lot of water. And also it will further improve. The pigmentation will gradually go away and you will still see that lifting effect on the under eye region. So it's correcting the volume loss. Also the dehydration of the skin under eye, it's gonna correct that too. Because some people have this dehydrated skin under the eye or there's poor skin turgor, then your hyaluronic dermal filler will improve that or correct that. Any question, Jorin?
Tita, I noticed you
Yeah,
pressing it after
pressing
the
it.
procedure.
Yeah.
Do I have to do that myself?
Yes. So for the 2-week time, you have to also do like a gentle massaging or like a gentle pressure only to help also the filler to spread evenly under the eye region. So you can do that too. So like during the time when you're washing your face, you can do like that. Press on it just to spread it evenly or do like that. Okay. So that's a very good question. Yeah. Then drink a lot of water also because it will further help the improvement because the filler attracts water. So it will hydrate the skin under the eye and it will restore the glow, the radiance of the skin under the eye. Because you notice when we're so tired, we lack sleep or haggard looking or stressed looking, it's really the under eye region that they see or notice that being so lacking in energy or lacking in vigor. So with the help of the dermal filler, you restore the eye glow, or like some will say, immortalize the eyes, or make it more radiant, or give you those enchanting eyes, alluring eyes. And over time, you will still see improvement under the eye.
Yeah, I see it already.
And for those people who are doing also makeup on their face, it's good thing that you have hyaluronic in your skin tissues, because the makeup can really attach well on the skin. And it has a good blending also on the skin. And there's a better glow. So I use also my Vital Light to restore skin glow. So for some people who wanted to have that healthy looking, younger looking skin, glowing skin, you can make use of our light filler, dermal hyaluronic filler. Okay, so now I've seen the result.
Yeah.
And over time, it will still improve. Since we have done before the treatment on the skin whereby we closed pores with the use of our incobotulinum toxin type A, actually also our Ulthera will help further in improving the skin texture. It will also stimulate further collagen, inducing further closure of our skin pores. It's also gonna improve the skin texture over time. So many benefits.
I know.
Right, with this non-surgical procedures right now, so we can achieve what we want. We can maintain that younger looking skin, especially during still young, still a baby, right?
Yeah.
Do you have any more questions?
Nothing naman bawal to eat. Nothing.
So you will just have to avoid allergogenic types of food, yung mga malalansa, okay? And in terms of the activity, no heavy nor strenuous activities yet for just few days, because the procedure we have done are just minimal. It's not really super invasive, okay? Huwag mo munang magbuhat ng mabibigat also, okay? And anyway, you're doing your online schooling naman, so nothing so very much or strenuous activities.
Yeah, except
Okay.
PE. Pero,
Oh, you do PE pa?
Yeah.
Really?
Yeah.
How do you do PE on the... okay, in front of the camera.
Dance siya. Yeah. But I won't,
I
okay
thought,
lang.
yeah.
If you'd rather na
Just few days
not to
only.
muna. Yeah.
Few days only. And right now, of course, expect a noticeable erythema or redness again from the marks of our needle here, this side here and there. That's temporary. It's gonna go away also. And then we'll just put some topical cream over that. And then you will still see further improvements as time passes by. Okay, so that one, actually others are asking how long will it last? That's another important question. Well, for the skin filler, okay, it depends also on the lifestyle, and it also depends on your metabolism and the kind of filler that we use. For the very light fillers, low molecular weight, well, there are cases we say 3 to 6 months for these kinds of fillers. Okay, some of my patients would repeat it in 6 months' time. It's like parang Botox also that they repeat twice a year, or the others as early as 3 months they can do it. But I have other patients, they repeat it after a year because they are telling me na it's still there, it's still okay. For some patients, they were saying that the filler is still there, doc, I can repeat in a year. The others, 2 years. It's still okay. So it really depends on the individual response plus our metabolism and your environment and your lifestyle.
How you
okay?
take care of yourself.
How you take care of yourself, exactly. But you can do a repeat of this like in 3 to 6 months time. And the Ulthera also, like for young ones, once a year, okay na. Okay? So a lot of information today, right? Okay, so actually if you wanna also ask Doreen about like how does it feel, or what was the result, actually she shared with us her
Social media,
Social
you
media.
can tweet me at Bautista Doreen. You can message me on Facebook, actually, Doreen Bautista, or
Yeah.
DM me on Instagram at Doreen Bautista.
Yeah, because the others are asking, masakit ba? Tapos, may result ba? Or after that, kamusta naman? Something like
result.
that.
It's the instant result.
Yes, actually, instant natural result. Okay, and for those who still have further questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Derm Centre or CSA Medical Aesthetics. Also, our Instagram, CSA Derm Centre or CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. So if you have missed the episode that we had done for Doreen, just watch it in our YouTube channel, Contessa Salvador. So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.